Good afternoon, and thank you for joining us this afternoon. I'm here as the chair of Kentucky Health Now, which I chair for Governor Beshear, as part of our effort to track progress on the critical health issues facing Kentucky. And today we're here to talk about and highlight an important health issue for all Kentuckians, and that's HPV vaccinations. I'm pleased today to announce a new public awareness effort, the Stop Hpv Campaign, designed to make parents aware of this breakthrough vaccine that can prevent cancer and save lives. By educating and encouraging the public to take action, we can improve the health of our children and our grandchildren, and really the health of the entire Commonwealth. The fight against cancer is a very personal issue for me because I'm a cancer survivor. And my interest in health policy and my own experience with a life-threatening illness has made me very committed to these issues. And it's why I'm pleased today to join Health and Family Services Secretary Audrey Haynes and Public Health Commissioner Dr. Stephanie Mayfield to talk about the readily transmissible virus at the center of this campaign and why it is such an important health issue, not only in Kentucky but throughout the country. HPV, the human papillomavirus, is common, and some diseases caused by HPV can be deadly, including cervical cancer and certain types of oral cancers. Other HPV-associated diseases may require doctor visits, medical or surgical procedures, and lead to health complications. An estimated 79 million Americans are currently infected with HPV, and the CDC reports that there are 14 million new HPV infections each year in the United States. And those who are infected with the virus are often unaware that they are infected. According to 2010 census data, there are about 26 million girls under the age of 13 in the United States. If none of them receive the HPV vaccine, over 168,000 will develop cervical cancer, and more than 54,000 of them will die. To combat these devastating but correctable numbers, we've developed the Stop Hpv Campaign, because as state leaders, we recognize that HPV is a significant health threat, and we're committed to preventing it. Developed and produced by the Louisville-based Doe Anderson Advertising Agency, this marketing campaign will feature television, print, and digital advertisements that will be placed in media markets throughout the state. The campaign is being funded by a $500,000 federal grant from the Centers for Disease Control and Prevention, which the Department for Public Health applied for and received to promote adoption of this vaccination. The primary goal of the campaign is to reach all parents of 11 and 12-year-old boys and girls in Kentucky and encourage them to get their child vaccinated. We're also reaching out to healthcare providers, local health departments, and community partners, and seeking their support in the fight against HPV. Experts tell us that this vaccine, which is safe and highly effective in protecting against the most common cancer-causing strains of the virus, should be a routine part of adolescent health. As Lieutenant Governor, as I mentioned, I chair Kentucky Health Now, which tracks our progress on a number of critical measurable goals, including reducing cancer deaths in Kentucky. And I have frequently said that our state leadership should never rest until we no longer have the highest mortality rate for cancer in America. It's a statistic we just shouldn't be able to live with. And we believe that this public awareness campaign can move the needle significantly in reducing this particular health threat. It's the smart thing to do. It's cancer prevention. And as you take a look at the campaign, you'll see that it emphasizes the vaccine's role in protecting children against a potentially deadly health threat. If you want to know more, particularly if you have children between the ages of 11 and 12 years old or teens who have not had the vaccine, we strongly encourage you to talk to your health care provider and make a plan to get your child vaccinated. It will protect your child, and it will help stop HPV. Now let's take a look at the Kentucky Stop HPV campaign, and then I'll ask Dr. Stephanie Mayfield to have some additional comments, and we'll open it up to questions. Thank you. Thank you. Now I'd like to introduce Dr. Stephanie Mayfield, Commissioner of Public Health, for some additional comments. Dr. Mayfield.
Thank you, Lieutenant Governor. I'd like to take a few moments now just to talk to you about what the HPV vaccine really means and why we think it is so important for the health of our Commonwealth. Immunizations, vaccines, are part of the foundation of American public health system. They are our frontline defense of many deadly infections, against many deadly infections like measles, polio, pertussis. In fact, we have nearly eradicated wild polio virus because of vaccines. Also, eradicated smallpox. We want to do the same thing with HPV through vaccines. Fortunately, our vaccination rates of diseases like polio and measles and mumps are relatively high, and as a result, outbreaks of those types of vaccine-preventable diseases in Kentucky aren't something you hear about very often. As the Lieutenant Governor just explained, this isn't the case with HPV. Moreover, reasons for not vaccinating our boys and girls against HPV seem to vary. Some parents say they're not getting it because their child is not active sexually and doesn't need it. Others simply don't know about the vaccine. A number of people have safety concerns. Many don't get the vaccine simply because their provider doesn't recommend it. We cannot stress enough to you the importance of getting vaccinated for HPV. It is cancer prevention. By getting your child vaccinated with HPV vaccine, you are preventing the spread of a virus and protecting your child from developing one of the HPV-related cancer. The vaccine is safe, effective, and is a long-lasting protection against most cancers caused by HPV infection. Our low vaccination rates, we must do better. Despite the fact that HPV vaccine has been around since 2006 and can prevent the spread of the virus and its associated health risks, not enough Kentuckians are getting it. According to the CDC's most recent data in the United States, an average of 38% of adolescent females between 13 and 17 years old received the recommended 3-dose of the HPV vaccine. Kentucky's adolescent girls averaged 27%. Worse still, only 19% of our adolescent males in Kentucky have received all 3 doses. Meanwhile, this terrible health problem continues to grow. If you are a healthcare provider, talk to the parents about HPV vaccine and make sure they are informed about its health benefits. You might find many think the vaccine simply is not necessary. In 2012, 8 in 10 girls who had not yet started the HPV vaccine series saw a healthcare provider and received at least 1 vaccine, but not the HPV vaccine. If these girls all received HPV vaccine at the time of that visit, the first dose coverage would have been 93%. We believe that high vaccination coverage is possible with more informed population and healthcare providers encouraging parents to get their children vaccinated. If I told you we found a way to dramatically reduce or even eliminate deaths from breast cancer, lung cancer, or colon cancer, I think you'd all say, sign me up. Yet for various reasons, we have struggled to encourage Kentuckians to take advantage of the HPV vaccine. As of today, the Commonwealth's HPV vaccination rates of 27% are well below the national average. Meanwhile, though, the national average at 38% is nowhere near where it needs to be. The health of our citizens suffers from this type of inaction. Parents, particularly those of you with 11 and 12-year-olds at home, take advantage of any visit to the doctor, checkups, sick visits, even physicals for sports or schools, to ask your provider about the HPV vaccine for preteens and teens. Vaccines are most protective before infection occurs. Even if your doctor doesn't mention the HPV vaccine, be sure to ask the doctor or nurse about getting it for your child at that appointment. Just because your doctor doesn't bring it up doesn't mean the HPV vaccine is not offered or that your provider thinks it is not necessary. We want all kids who are 11 or 12 years old to get the 3-dose series of HPV vaccine. Teen boys and girls who did not get the vaccine when they were younger should get it now. Young women can get HPV vaccine through the age of 26, and young men can get the vaccine through age 21. However, certain other high-risk populations, it may be recommended to get the vaccine through age 26 if they did not get it when they were younger. Families who need help paying for the vaccine should ask their healthcare provider about the Vaccines for Children program called VCF. VCF provides vaccines at no cost to uninsured children and younger than 19 years. For help in finding a local healthcare provider who participates in the program, parents can call 800-CDC-INFO or 800-232-4636 or go to Vaccines and Immunizations. If you are insured, health plans also cover the cost of HPV vaccine. I'm also happy to report the vaccine is offered in a variety of healthcare settings, including family practice, pediatric, local health departments. If you are unsure if the vaccine is available in your community, call your provider or your local health department to get more information. Some facts to take home, please. 56% reduction in HPV infections in teen girls in the U.S. has been seen since 2006. That's a significant reduction, and we're headed for eradication. Each year, about 17,500 women and 9,300 men are affected by HPV-related cancers. Let's stop this and eradicate these infections. I thank you for joining us here today and helping us stop HPV and launching this campaign with us. We need your help in educating Kentuckians about the benefits of HPV, and we believe more young people will get vaccinated because of our campaign, and we can prevent the spread of this terrible disease now and for generations of Kentuckians. Thank you.
Thank you, Dr. Mayfield. Any questions?
When's the campaign start and how long will it run?
Okay.
Do you know exactly?
Actually, our campaign has started, but this Doe Anderson advertisement should be up and running soon. We can get you that
July 20th?
July
If it was
20th.
the end of July or the 1st of August.
Yes. But we have, in public health, have been promoting this vaccine. We've been declining in that since vaccination, and that vaccination is given younger and younger because,
I'm sorry.
yes.
Is it mandatory in any state that you know of?
There are a couple of states that have sort of quasi-mandated it, but I don't know of any states that have tightly tied it to school entry.
And I think that's an important point, Jack. It is not mandatory in Kentucky, and that's why this effort, this extra push to try to raise public awareness and encourage families to do it voluntarily. Anything else?
Girls and boys.
Absolutely, girls and boys. And 11 or 12 is a good age because there are other vaccines that coincide with that, back-to-school checkups. So that is why, and we want to always try to give vaccines before infection occurs.
A non-medical question, but a parental question.
Yes.
So if I have a 11-year-old daughter, 11-year-old son, and I want him or her to get this vaccine, should I explain to them the purpose of it?
Yes, it is a
To prevent
cancer
cancer?
prevention.
I mean, but the section, it's only transmitted sexually?
No, it is not.
Is that-
The human papilloma virus can be transmitted in some cases at birth when a baby is passing through the vaginal canal. There can be exposure at that point. Most cases, though, are linked in the particular HPVs that we're focusing on to that type of activity, of sexual activity. However, we're trying to prevent cancer. And vaccines, again, are most effective before infection occurs.
I want to thank Dr. Mayfield and her staff for the initiative in going after this grant, and Secretary Haynes for your leadership in putting this campaign together. I think this is one more step forward in creating the legacy of a healthier Kentucky. So thank you very much.